Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Dr. Tania Kohal, a pulmonologist and critical care specialist at Terrebonne General Health System. We will be discussing her role in pulmonology and the vital service that she'll bring to our community. Welcome to the show, Dr. Kohal.
Thank you so much for having me.
All right, well, let's get started with you telling us a little bit more about yourself and your role at Terrebonne General Health System.
Sure. So I grew up in California, but have lived in a lot of different places, did all of my training out in Detroit, then moved down here for a fellowship at LSU, and I'll be providing pulmonary and critical care services here at Terrebonne.
Okay, so you fell in love with Louisiana at LSU, right?
I sure did. I didn't want to leave.
Well, we're happy to have you. So what first made you decide to get into the medical field?
You know, I really wasn't sure when I was in college. I was interested in so many things, like a lot of people are, and I started volunteering at a free clinic, and it just felt really great to be able to interact with people in a moment when, you know, they might be very happy, they might be very sad or stressed out, and be able to help them.
All right, and why did you decide to pursue a career in pulmonary medicine?
Pulmonary medicine is so interesting. Breathing and how you feel about breathing affects everybody's lives every day. And when people are sick, they really feel it. It's nice to be able to engage in partnership in their care and also to work in a field that has a lot of new exciting changes coming.
All right, and that includes critical care as well.
Correct, yes.
Okay, and what type of illnesses or disorders do you treat?
So we see a host of different patients in the ICU, of course, that are really ill. In the clinic, we encourage anybody that has any kind of lung disease that they already know about, asthma, COPD, pulmonary fibrosis, anything like that, to come see us. Or, you know, if they just aren't feeling well or starting to feel short of breath, we're happy to evaluate them and see how they're doing.
Okay, and tell us more about, as a pulmonary and pulmonologist and critical care specialist, how are you going to be helping patients in the hospital and at your clinic?
Yeah, so we're going to be helping with in the hospital and clinic, both with diagnoses, in the clinic, a little bit more with longitudinal care, and I'm hopeful that even in our ICU patients and the patients we're seeing in the hospital, that they can keep following up with us in the clinic.
All right, and why do you think this specialty is so beneficial to our community and health system?
I think pulmonary diseases are really something that affect a lot of people in our community. Louisiana has one of the highest smoking rates of anywhere in the country, and with that comes a lot of lung disease, and I think it's important that we have people in the community that are helping take care of people.
Okay, and just a little bit more about the types of illnesses that you treat.
Sure. So COPD, which is a common disease that we see in the community, especially with people that have been smokers. Asthma, which is also really common in children as well as adults. But even some of our more rare diseases, pulmonary fibrosis, pulmonary hypertension, are all things that we can help people with in our clinic.
Okay, and what are you most excited about starting your career here at Terrebonne General?
I'm really excited about everybody I'm going to be working with. I feel like we have such a great team in our clinic and in the hospital. I feel like from the patients I've met so far, everybody in this community is so incredible. They're just amazing patients, amazing people, and they have some incredible stories.
Okay, and what is your favorite type of illness to treat?
I would say probably lung nodules, COPD, and asthma.
Tell me about some of the latest developments in pulmonology.
So some of the things that we're seeing in the field that I think are really benefiting patients, especially those with lung nodules, so people that have spots in their lungs that we want to investigate, is we have a whole new line of what we call robotic bronchoscopies that are just starting to take off in the field, and hopefully we'll be people that continue to provide that service or are able to provide that service here, which is something that is really cutting edge and I think will benefit our community.
Yeah.
Other things we've noticed is that we're starting to have new medications that we're using for treating things like ILD and pulmonary fibrosis, and there's a lot of research being done in those fields as well as pulmonary hypertension. And every year I think we're adding to the number of therapies that we can give patients.
So you help patients to be able to have a higher quality of life while they're dealing with some of these disorders.
Yeah, absolutely. And I think, you know, that's one of the most important things to us as pulmonologists. We know it's really horrible when you can't breathe and you feel short of breath. So we focus a lot on taking care of patients' symptoms and talking to them about their quality of life and disease management in our clinic.
All right, what are three of the most important things you want people to know about pulmonology?
So I want them to know that please don't be intimidated by coming to see us, even if you're short of breath and you don't know why. It's been a long time or a short time. We are happy to help. We have a great clinic staff and pulmonary function crew that helps us do all of our ancillary testing, and that we will try and get to the bottom of what's going on with you. I think another thing I really want people to know is that we are kind of the catch-all doctors. We can see you in the hospital. We can also see you in the clinic. We do all of our own procedures. So when you come to see us in the clinic, we're really going to take care of you from start to finish.
All right, well, great. And are you accepting new patients?
We are, so I'm happy to see anyone in the community that wants to come see us. We have a lot of clinic availability right now for me personally and one of our other new providers. So please come. We're happy to see you, and we're looking forward to seeing people.
All right, and how can patients schedule an appointment with you? Do they need a referral or?
So they can get a referral. We also have a clinic phone number, and they can call us and make an appointment.
All right. Well, thank you so much for sharing all this information with us, and welcome aboard.
Thank you. Thank you for having me.
For more information about pulmonology care at Terrebonne General Health System, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and we'll see you right back here next week.